Pharmacology, the respiratory system. The effects of secondhand tobacco smoke. The burning of a tobacco cigarette creates multiple chemical compounds that are released through mainstream smoke, which is inhaled by the smoker, and through side stream smoke, which is the smoke that is given off by the burning cigarette. Secondhand smoke, which is a combination of side stream smoke and the mainstream smoke that is exhaled by the smoker, has been demonstrated by numerous scientific studies to cause disease. At least 40 chemicals in side stream smoke have been identified that negatively impact human health, leading to the development of cancer or other conditions such as immune system dysfunction, liver toxicity, cardiac arrhythmias, pulmonary edema, and neurological dysfunction. Furthermore, secondhand smoke has been found to harbor at least 250 compounds that are known to be toxic, carcinogenic, or both. Some major classes of carcinogens in secondhand smoke are polyaromatic hydrocarbons, N-nitrosamines, aromatic amines, formaldehyde, and acetaldehyde. Tobacco and secondhand smoke are considered to be carcinogenic. Exposure to secondhand smoke can cause lung cancer in individuals who are not tobacco users themselves. It is estimated that the risk of developing lung cancer is increased by up to 30% in non-smokers who live with an individual who smokes in the house, as compared to non-smokers who are not regularly exposed to secondhand smoke. Children are especially affected by secondhand smoke. Children who live with an individual who smokes inside the home have a larger number of lower respiratory infections, which are associated with hospitalization, and higher risk of sudden infant death syndrome. Secondhand smoke in the home has also been linked to a greater number of ear infections in children, as well as worsening symptoms of asthma. The nursing process related to respiratory medications. Now that we have reviewed the respiratory system and common respiratory disorders, let's apply the nursing process to the administration of respiratory medications. Assessment. Although there are numerous details to consider when administering medications, it is always important to first think about what you are giving and why. First, let's think of why. Respiratory medications are often given to alleviate allergies, cold symptoms, or to eliminate shortness of breath. An important piece of nursing assessment should be to assess the patient's respiratory status. The respiratory assessment includes observing the respiratory rate and quality of respirations, shallow or deep, obtaining a pulse oximetry reading, and auscultating lung sounds. Other pieces of the assessment include inspecting skin color, such as observing for pallor or cyanosis, and determining if there is a cough or sputum present. If sputum is present, it should be assessed for color, odor, consistency, and amount. Additional baseline information to collect prior to the administration of any respiratory medication includes any history of allergy or previous adverse drug response. The implementation of interventions. Respiratory medications are available in many different formulations, such as nasal spray, inhalations, oral tablets or liquids, injections, or intravenous route. So it is always important to verify the correct route and anticipate the associated side effects. For example, inhalations deliver the required medicine or medicines directly to the lungs, which means the medicines can act directly on the lung tissue, minimizing systemic side effects. On the other hand, intravenous medications are administered to act quickly, but can cause systemic side effects. Additionally, some products contain more than one medicine without different dosages. For example, inhalers that combine a long-acting bronchodilator with a glucocorticoid. During the administration of respiratory medications, it is important to anticipate the expected outcome of the medication, and any common side effects. For example, albuterol is a short-acting beta-2 agonist that is given for bronchodilation. The nurse should plan to perform a respiratory assessment before and after administration of albuterol to document the effectiveness of the medication, as well as monitor for tachycardia, a common side effect. Additionally, the nurse should also ensure the proper use of the inhalers by the patient, observe the patient self-administering the medication, and further instruct the patient in proper use. Evaluation. Finally, it is important to always evaluate the patient's response to a medication. With respiratory medications, the nurse should assess decrease in allergy symptoms, cough, runny nose, tearing eyes, and any decrease in shortness of breath. The nurse should complete a respiratory assessment, respirations, pulse oximetry, and lung auscultation before and after the medications have been administered, and compare the results. If the symptoms are not improving or the clinical assessment is worsening, prompt intervention is required, such as notification of the healthcare provider for further orders to prevent further clinical deterioration. Now that we have reviewed basic concepts, we will take a closer look at specific respiratory classes and specific administration consideration, therapeutic effects, adverse side effects, and teaching needed for each class of medications. Antihistamines. Diphenhydramine is an example of a first-generation antihistamine. Second-generation antihistamines were developed to have fewer side effects. An example of a second-generation antihistamine is cetirizine. Diphenhydramine is a first-generation antihistamine that is available orally or as an IV medication. Mechanism of action. Antihistamines have the following mechanisms of action. It blocks the histamine at H1 receptors, inhibits smooth muscle constriction in blood vessels and the respiratory and GI tracts, and decreases capillary permeability, salivation, and tear formation. The indications are antihistamines are used for relief of allergy or cold systems. Consideration. This medication is not safe for children under the age of 2 without a healthcare provider's order. Adverse effects. First-generation medications can cause anticholinergic effects such as dry mouth, urinary retention, constipation, and blurred vision. CNS depression or CNS stimulation with excessive doses can occur, especially in children. Therefore, first-generation antihistamines should be used with caution in the elderly. Second-generation medications may cause headache, nausea, vomiting, dysmenorrhea, and fatigue. Patient education. Patients should be advised that antihistamines may cause drowsiness, and concurrent use of alcohol or other CNS depressants should be avoided. Patients should take only the recommended amount of medication and not to exceed dosing recommendation. Some patients may experience side effects such as dry mouth, and frequent oral hygiene may assist in alleviating discomfort. Medication grids are intended to assist students to learn key points about each medication class. Avoid allergens, avoid alcohol or CNS depressants due to sedation. Temporarily receive symptoms due to hay fever or other respiratory allergies, runny nose, sneezing, itchy, watery eyes, itching of the nose or throat.